This is for ADHD, so we'll look at the symptoms, lifestyle factors, supplements, and medications. I think there was a doctor that documented that people with ADHD almost always has either bipolar or mood swings, and vice versa, right? But this often gets overlooked, and I think that's part of the issue with psychiatry. So you can go to different psychiatrists, present the exact same symptoms, and get different diagnoses from each one of them. ADHD does have a lot of positive characteristics too, especially if you're physically healthy and emotionally well off. So crisis-induced hyperfunction is one of the more interesting ones. Basically, the worse it gets for everyone else, the higher functioning you become. Well, the traits we have today is because they were passed on, right? So in history, we always had cataclysms, resets, and famines, etc. So I think there had to be a certain percentage of the population that would thrive in that kind of chaos. Having said, I don't think people really had true ADHD before immunizations came. Yeah. But I think neurodivergence always existed, probably more as a positive expression compared to what we have today. We'll get to the supplements in a minute here, but this is an attempt at positively rewiring your brain, so we want to incorporate good habits, right? So I do notice picking up the phone first thing in the morning can set a lazy tone for the day. Drinking alcohol can make me unmotivated for the next few days. And lack of sleep is like the worst, right? Something I've not seen anyone else talk about is endorphins and opioid receptor. I believe that is as important as dopamine in the case of ADHD. So I noticed this when opioids completely lifted the symptoms, and so did dextrin. Well, the amphetamines also raises endorphins, whereas other dopaminergics like bromontane, sledgeline, modafinil, they help to some extent, but didn't really fully help with the motivation and attention. But of course, we don't want to use opioids, so what we can do instead is eliminating opioid receptor disrupting foods like gluten and dairy. If you don't feel comfortable about doing gluten and dairy free, then you can at least cut out the junk foods, right? Like pizza pops, Coca-Cola, Fruit Loops, and cereals. Yeah, they do affect the mind a lot. I would even say they're weaponized food industry system. For the supplements, I think saffron is the most potent one and noticeable one. Just make sure you're not getting one of the rare side effects from these supplements. I think saffron can trigger hypomania or insomnia. NADH can be overstimulating, especially above 5 milligrams, right? Ginseng can raise blood pressure. It can worsen OCD or tics. CDB choline and L-CAR, the cholinergic supplements, they can worsen anxiety or depression. Yeah. Other common side effects you can just Google and find out, and make sure there's no interactions with the medications you're taking. My approach is to do things holistically and keep medications as last resort. But I understand prescription meds can be necessary, especially with modern lifestyle, right? But I do encourage you to work on a diet and habits, because medications alone won't get rid of all the symptoms. That's pretty much it, guys. You can take a screenshot of this if you want, but this is just if you want to do a deep dive, or if you're a medical student or a doctor that wants to understand ADHD better. So otherwise you can skip it. Well, when I see interviews of ADHD specialists, they seem to just talk about the neuroscience and habits, and otherwise they don't really give good solutions that makes a real difference, right? Because they don't address the root cause, they don't address deficiencies or toxicities. So I think the bar is set pretty low, and maybe you can be the one to make a difference.